Good morning students. I Priya, science teacher in Holy Cross, Texas, Bagu, going to share every important aspect related to cardiologist or cardiac surgeon. Nowadays, chances of heart attacks and heart-related abnormalities are increasing a lot because our lifestyle has changed, then the chances of heart attacks are increasing. In this situation, a cardiologist or a cardiac surgeon has solution of every problem because they are the specialists of heart-related disorders. Now, one question arises in our mind: what a cardiologist or a cardiac surgeon do? Actually, a cardiologist perform laboratory works like we do ECGs, blood pressure checking and other laboratories work, etc. But a cardiac surgeon perform heart surgery, lung surgery, heart transplant, lung transplant, bypass surgeries, etc. But do you know, it is a very long process to become a cardiologist or a cardiac surgeon. So do you know what are the steps you should follow to become a cardiologist or a cardiac surgeon? I am here to tell you. A lot of steps are there. So the first step is you have to do your 12th class with medical stream. That is, during your 12th standard, you have to take physics, chemistry, biology as your main subject. And the minimum score should be 50% for general category and 40% for reserved category. And your age limit should be 17 years to 25 years. Now the second step, which is the most important step to become a surgeon. That is, you have to clear the NEET exam. NEET is a National Eligibility Entrance Test that is conducted by CBSE, New Delhi. And from year 2016, Supreme Court had banned every state level test, every university test to take admission in MBBS or BDS courses. So, firstly, you have to crack this exam, then you will follow the further steps. Now, the third step is you have to do your MBBS course. Now, what is this MBBS course? MBBS is Bachelor's in Medicine and Bachelor's in Surgery. That is, two courses together in one degree. This is a 5-year and 6-month program in which 4-year and 6-month in your academic education and 1 year for the mandatory internship. This mandatory internship means that internship is compulsory for everyone. That's why this course takes almost 5.5 years. And it is the only course in India by doing which you will become a doctor. But you are planning to become a surgeon, then you can't stop up to MBBS. Now, the fourth step is you have to do your PG courses. Now, what are these PG courses? Actually, cardiologist or a cardiac surgeon, they have different field work. So, if you want to become a cardiologist, then you have to do the MD course. And if you want to become a cardiac surgeon, then you have to do the MS course. Now, the MD and the MS courses are completely different. The MD course means Doctor of Medicine and MS course means Master of Surgery. Okay? Now, there are a lot of universities from where you can pursue your MBBS courses and other courses, etc. These universities and institutes are All India Institute of Medical Sciences AIIMS, Jawaharlal Institute of Postgraduate Medical Education and Research, Jimmer, Christian Medical College, CMC, Maulana Azad Medical College, New Delhi, King George's Medical University, Lucknow, and Annamalai University, Tamil Nadu. Now you have followed 4 steps. Now 5th and the last important step is the super Actually, as I told you that cardiologist or a cardiac surgeon, they are the specialist of heart. So you have to do a specialty course. The super specialty courses are also different for a cardiologist or a cardiac surgeon. If you want to become a cardiologist, then you have to do the DM course, and if you want to become a cardiac surgeon, then you have to do the MCH course. And in this course, you are not going to go in any university or college. No. You will work in a hospital. Actually, the 4th step and the 5th step, that is your PG course and your super specialty course, they are of 6 years. And you are going to spend all these 6 years in the hospital, where you handle the patient, where you will do the research, where you will do the experiments. That means study and job together, experience and knowledge together. Now, the 6th step is, after doing all these 5 steps, the Medical Council of India will give you the medical certificate or medical license. And by getting this license, you are a surgeon or you are a cardiologist. So all these steps you have to follow. Now one question will come in our mind, what after that? We are spending almost 11 to 12 years of our life in this profession, and what will we get after that? So next is the salary. Actually, this medical line is the only field during which you will get stipend during your studies. When you do your MBBS, you will get few thousands of stipend. But when will you do your PG courses, you will get stipend of about 80,000. And when you do your super specialty courses, that is your DM or MCH courses, then you will get stipend of around 1 to 1.5 lakh. It is not bad. And when you get the certificate or your license, then you will earn 3 lakhs per month as a fresher. And when you get experience or depends on your skill, you can earn up to crores. That means it is not that much bad field, because if you are spending that much years of your life, you are earning too. But it is very responsible profession. You can't only think about money, you have to think about your patients also. You have to think about their problem also. And you can solve their problems only when you are capable of solving these problems. You should have some important skills by which you can solve the problems of your patient. Now the important skills that a cardiologist should have: ability to work with a team. That means you are going to complete the ICU room, the operation room. You are going to handle that room. A lot of ward boys, a lot of sisters, a lot of nurses, your patient, everyone will be under your observation. Deep interest in being a helping professional. You should have a heart also. Good stamina, responsible attitude, patience and compassion, constant updating of skills and knowledge, mental alertness at all times, very good communication skills and interpersonal skills. In this profession, communication skills are very important, because if you are good in your communication skills, if you are knowledgeable, then only you can understand your patient. If you are confident, then you can make your patient confident. By your talking ways, the patient will forget his pain. You should be soft from your heart, but you should also be hard from your heart. You should be emotionally, mentally, physically prepared, because this profession is not that much easy. A lot of hectic will be there. You have to be on your toes. You should always be ready for the emergency. Everything you have to manage. You will get very less time for yourself. You will get very less time for your family. But when you save the life, when you see the smiles on the faces of that patient, their family members, you will forget your pain. So if you want to serve your country, if you want to save the lives, you should definitely follow this profession. And now, I think this video is going to be very helpful for you. I have shared every important aspect related to cardiologist or a cardiac surgeon. So if you like this video, then please like, share and comment about all other topics which you want us to share with you. Thank you. Have a nice day.